President sir, may I start? Amit will
Uh,
join.
Amit join?
No, no, he will join. You call.
Okay. You can start.
Yeah. So, good afternoon.
Sir, I will just invite you. Sir. Just a minute.
Yeah.
Nilmohan madam called up that she is joining, so I thought that by the time I think I start and invite you, she will join.
Yeah,
Madam.
madam join.
So this uh, good afternoon, everyone. I think all of us we know that World Mental Health Day, 10th October 2025. It is a reminder for us that there is
Hmm.
no health
Okay.
without mental health.
Okay.
And this
Okay.
year's
Program.
campaign focuses on urgent need to support the mental health and psychosocial needs of people affected by humanitarian emergencies. So this is very important that this is a primer for our World Mental Health Day on 10th October. And this is a really a good initiative of IIP leadership to select this topic for IIP की बात community के साथ. I request now Honorary Secretary General of Central IIP, Dr. Yogesh Parikh sir, to give a welcome address.
Thank you, Dr. Gita Patil, madam. Namaskar and very welcome to all of you. It is my privilege and pleasure to welcome all of you to this all ninth session of our flagship program of the year 2024 and 2025 IP की बात community के साथ. And today's our program is based on the mental health matters to the all, especially for the children. So it touched the very corner of our mission as a pediatrician and the healthcare provider and advocates for the child health and the child well-being. So we all know the mental health is not a luxury, but it is a very necessity, and it is not only concern for the few people, but it is our responsibility for all. And when it comes to the children, it is our sacred duty. So in today's fast-paced, digitally connected, and emotionally fragmented world, our children face pressure that very often invisible to us but deeply impactful to them, and from academic stress to the social isolation, from screen addiction to the emotional neglect, so many challenges are real, and so it is must be our response to these all challenges. So through this session, our aim to break the silence, dispel the stigma, and build a culture of the empathy, awareness, and the timely intervention by all of us. So IP stands committed to be integrating mental health into every pediatric conversation, every our child health program, school health program, and every community outreach our efforts. So I extend my heartfelt thanks to the our IP की बात community के साथ core team, Dr. Geeta Patil Madam, Dr. Kishore Baindur, and Dr. Praveen Page, and many others with the scientific committee of this mental health program. So I welcome all of you, and I welcome Dr. Vasant Kalatkar, Dr. Neelam Mohan Madam, Dr. Basavara, Dr. Preeti Galwani Madam, Dr. Ramesh Bajania ji, and Dr. Our all the esteemed office bearers and the scientific committee members, Dr. Poonam Madam, then Dr. Shiv Bachchan here, Dr. Ashok Kumar sir, Dr. Vijay Dr. Ramesh Bajania ji, Dr. Sudhakar sir, Dr. Keshi Tamaria, and many others have joined today to give support to our mission. And I welcome all of you for this very noble cause. So let us join hands together with us today. Our all of your presence reinforce our belief that together we can nurture not just healthy bodies but the resilient minds. So let this mission and the session be the call to action and the call to listen more deeply, to act more compassionately, and to advocate more powerfully for the mental well-being of our each and child of our nation. So thank you once again for the being part of this journey. Let us make mental health a priority, not just today, but every day. So Jai Hind and Jai IP. Over to you, Geeta Patel, madam.
Thank you very much, sir. It is you are appropriately you are described the need of the mental health. We know that 1 in 7 children globally are having a mental health problems. Many times we ignore it. So it is a very important for us to know, as you have mentioned. I request our President IAP, Dr. Vasant Khalatkar, sir, to address.
Uh,
Over
yeah,
to sir.
Dr. Geeta, respected Dr. Neelam Mohan, our incoming president, year 2023, our Honorary Secretary General Dr. Yogesh Parekh, Dr. Basav Raja, our President 2024 IIP, today Chief Guest, Dr. Amit, then Dr. Praveen Mehta, Secretary, past Secretary, all my office bearer, that's Dr. Priti Galgali, Dr. Arish Pembre, Dr. Bajania, and Dr. Guru Prasad, Dr. Prashant Sabut, then our all executive board member and all my 49,000 members. I bring you warm greetings to all my dear colleagues, friends, and respected guests. Wish you a very, very happy Diwali well in advance. Really, it gives me immense pleasure to welcome you all to yet another meaningful edition of IIP की बात community के साथ. This will be the 9th program of this year. When myself, Dr. Basavaraja, Dr. Yogesh started this program with the idea of Dr. Ajay Srivastava also definitely. So we never thought it will take this type of form, and which is a very famous program, one of the most accepted and famous program of Indian Academy of Pediatrics, because it's for community. Thanks especially for the team led by Dr. Geeta Patil and media and site committee by Dr. Samir Dalwai, then joined by Dr. Praveen Page, Dr. Amresh, Dr. Baindur, and all the team. That's really they are taking a great pain to make this program a successful and meaningful program. Really. Now, thank you for this total team, I will say. Without them, it was not possible to reach to this 19th, it's a 12 plus 9. That's a 21st program, I will say, of IP के बाद community के साथ. And with different topics. Where thank you once again for team IP के Before that, I know this initiative have become a strong bridge between pediatrician and community, helping us to take up pediatric health beyond clinic into home, school, and society, mainly to the public. So today, segment, our 9th segment of this year, that is a 2025, focuses on a subject that touches every family, every classroom, and every child mental health, even me. In today's world, children face unseen pressure from academics, digital exposure, peer expectation, and even family environment. As a pediatrician, we are not just healers of the body, but guardians of the mind and soul. We stand as the crossword where early recognition, empathy, and guidance can prevent a lifetime, a lifetime of struggle. This segment is not just another awareness talk, it's a moment of compassion. It reminds us that emotional well being is as vital as physical health and that mental health matters to all, especially for children. Under the umbrella of Indian Academy of Pediatrics, with nearly 49,000 members united in purpose, we are making a collective commitment to look beyond illness and nurture holistic wellness. I take this moment to appreciate our chief guest, Dr. Amit Gupta. He is working in Oxford, and just 8 days before we had been to Oxford, and I have seen his working style. That's a very meticulous. On the treatment, we are getting our ourselves and our fellows who are working under him. It's a real beyond appreciation. Thank you, Dr. Amit, for your efforts to make a Indian a super specialist, that to be in UK. I know without your help, it was not easy possible to collaborate with the Oxford University, that hospital, to get a fellowship for our student, and that to be without asking any money. Thank you, Amit. And
Thank you, sir. Thank you very much.
you. See, dear, it's a beyond. I know we will have a collaboration in future also, and more is expected from you for our Indian students. That's the only gain. We want our young generation, your generation. This is our theme this year, and one of the component we had done is a collaboration with Oxford University, and that's we are very happy with our trip in to the Oxford, that what our students are getting. Our inspection was very really good. We appreciate your work and thank you once again. Thank you, Amit, and thank you for joining also for this on one
Sorry,
same.
sir, I was a bit late. I think I mistook the timings a little bit,
No
but
issue,
I'm
no issue, Amit. And thank you, my elder brother, Dr. Praveen Mehta, with whom I have worked for 2 years. He was secretary and really flawless secretary, really, I will say. And really, it's a the power of convincing is really good. Thank you for gracing this program with their insight and experience. I also express my heartfelt gratitude to our dynamic leadership team, Dr. Neelam, Dr. G.V. Basavaraja, Dr. Yogesh Parekh, Dr. Preeti Galwali, all Vice President, for their consistent effort in carrying forward this vision of engagement and empathy. Together, let us pledge to make mental health a conversation, not a taboo. Let's ensure every child grow up in an environment that nurtures confidence, love, and emotional strength. My request to my all 49,000 members and those who are beyond border, those who are outside, that please spread up this message whatsoever IAP is going to give about the mental health children. Once again, thank you especially for a scientific team lot of pain to make this press note and all everything about mental health. Thank you all for being part of this transformative journey. Let us continue to make IP a voice of care, compassion, and charge. Please disseminate, circulate, and share the material to community. That then only we are going to win. Jai Hind, Jai IIT. Thank you.
Thank you very much, sir, Dr. Vasant, sir. Your mission definitely will be taken forward by everyone because this is a need of the day that we have to do it. Now, I request our President-elect, Dr. Neelam Mohan, Madam. She is always vocal about the need of mental health for everyone. And let us request her to address. Over to Dr. Neelam Mohan, Madam.
Thank you, Geeta, for this opportunity. I would uh, respected Dr. Vasanthi, Baswaraja, Yogesh, and all the senior members, VP, EB members who joined our chief guest, Amit, and guest of honor, Veenji. All of you, welcome to this podium. And the all of them have highlighted to you all, and it doesn't, nobody here needs to be more emphasized than the role of mental health today in the life. It is not only children and adolescents that we are talking about, but even adults who are supposed to be the role model are suffering from mental health issues. Not only patients, but even the people who are, their saviors, the physicians who are treating them are also suffering from mental health issues. And each one of us find it very difficult to communicate and to open up to each other. So as we realize that IAP has totally realized its responsibility, that it is not the physical, but we emphasize on the mental health, which will empower them to look into their social health. And eventually, when we talk about the spiritual science, last time it was nothing but empowering them for their mental health and physical health. So all of them put together is going to, it is time the pediatricians who have been efficient clinicians till now to move out of their walls to the community to move out of the clinical prescription to advocacy, and to realize this and empower the parents and the children, adolescents, and the community at large on these issues. As my previous speakers have highlighted, I'm not going to repeat anything about the need. Just want to say that though it is 1 in 7, even in India, post COVID, there was literally a 25 to 30% rise as per the ICMR study. But what is sad is 80% of this are not picked up. So the purpose of this entire program is not only to look into how we can reduce it, but to eventually see that if it is 1 in 7 and we are not able to address the 80%, what we can do for that. With that humble step, we want to start. And the message that has been beautifully drafted by the entire team of mental health is going to be circulated through the media and via all the pediatricians, because as beyond clinical work, beyond treatment, we need to look at prevention. And what more in prevention besides we've always been talking about the vaccination and ID. Here we are talking about this before this emergency becomes more threatening. It is high time we work in this if 80% are not diagnosed or picked up by this. It is our endeavor to take it not only from the pediatricians to community, but also to the schools and to the teachers, so that we are able to utilize the yuva, utilize the adolescents, utilize their peers in addressing this. This is a small step forward, and I wish more power to IAP in such future endeavors. Thank you once again. Three cheers to all the team who have done a good job, and more power to IAP. Jai Hind. Thank you, and wishing all of you a happy Diwali. Diwali is one function. The whole month teaches us that we need to celebrate each small little success. So even this success that we are in the process of moving out of our walls into community is a very big achievement, and we need to celebrate that. But there is lot more to do. As Robert Frost says, the woods are dark and deep, and there is lot for us to move and travel before we sleep. Thank you so much.
Thank you, Dr. Neelam, for your wishes. And let us celebrate this Diwali by reaching to community. Thank you.
Thank you very much, sir. Dr. Neelam Mohan, Madam, IAP has thought over, and we have got IAP ICP Mental Health in Children and Adolescent Certificate course with vaccinology, infectious disease, neurodevelopment. So IAP has already realized that mental health is very important, as important as vaccination, infectious diseases. So Dr. Basavaraj, sir, who is the immediate past president of IAP, he has conveyed his message. He is in the exam hall, so if possible, he will join. Now, time to see our activities, what we did in September. It is not only we are talking or launching, there are certain activities are there. I request IAP, Saji, to share our video.
Ma'am, the press note first.
Okay, sorry, I request all the two presidents to join and release our press note of this topic. Please share the press note.
So it's a silent crisis needing urgent action with 1 in 5 children affected and suicide, the third leading cause of death in teen. Expert call for early recognition, intervention, and Sigma. So this roll it. Next.
Just,
Nikita,
sir, scroll up, scroll up, scroll.
Guru. So slowly. So this is about everything included, that the mental health in children, key influences on mental health. Scroll up, and how to address the challenges. Okay, next. So with our main message is that with early detection, supportive environment, professional care, and reduced stigma, we can secure the mental well-being of children and adolescents, strengthening both individual lives and society. Definitely, we all. So we both, myself and Dr. Neelam, declare that this press note is released for circulation to all the pediatricians and digital media, print media. You can circulate this and you can use this press note for your communication. Thank you.
Dr. Neelam Mohan, madam, is there? I think.
Yes, I declare it open. Thank you for the kind opportunity.
Thank you very much for releasing our press note. And we know that press note is very compact, precise information which should reach to the community in different languages. And now, as I just was talking about our activities of the month of September, I request to share these activities. IAP, can you share our activities video? Activity videos, I think no one is there.
Saji, where is Saji?
Yes, he's sharing.
I want to mention that there are so many activities happened in this, but due to some communication gap and our this who's making these activities calendar is not well. That's why we couldn't highlight more and more activity. Amit, especially visit to Oxford, we want to show it. Actually, our those photographs, but this is due to technical problem we could make it. And all the those Yuva Pedicon and Lucknow Academy Pedicon, these all.
No.
Sure. Chalo. Thank you. Gita.
Thank you very much, sir. I think as sir has told that certain activities have missed in this, and because of the technical, some problem has happened.
Madam, due to election code of conduct is going on, so we have to take care and we have removed some part.
Yes, sir. Thank you very much, sir. Because there are many people, there are so many things are there, so we can't do that. But we can't help it for that. Now the time has come for us to listen to our South Zone Vice President, Dr. Preeti Galgali, madam. She has also worked in the mental health. So over to Dr. Preeti Galgali, we will get enlightened with her address. Over to Dr. Preeti Galgali.
Thank you, Dr. Geeta Patil. Congratulations to IAP and to all of us on launch of this wonderful, joyful module on mental health. I've gone through the module and I must congratulate the chairperson, Dr. Poonam Bhatia, and her team on this wonderful module. So we all know about the WHO definition of mental health, which says that people should be able to realize their abilities, achieve their potential, cope with stressors, and lead a very productive and happy life contributing to the society. So we are all familiar with this, but unfortunately, mental health issues are on the rise, as has been said, and there's a shortage of 75% of mental health professionals in India, and only 1% of pediatric mental disorders reach the psychiatrist. So it is really time for pediatricians to jump in to help the psychiatrists and the mental health professionals in not only diagnosing but also managing mental health issues. As you know, mental health issues issues fall in a spectrum. They can range for just a mild mental distress to a frank mental disorder. The advantage that we pediatricians have is we know the child right from birth. We have a fantastic relationship with the family, and we can pick up mental distress early and intervene before it goes into a full blown mental disorder. All over the world, there's a shift of mental health care, and the shift is towards community based care. And that is exactly what Indian Academy of Pediatrics is also following. So, the best resource utilization for mental well being is in what? You'll be surprised to know it is in alleviation of poverty, in cash transfer schemes, in social security schemes. So, when we have a poor population, we really can't be talking about mental well being. And the Mental Health Day this time focuses on mental health and humanitarian emergencies like climate disasters, floods, heat waves. So environment itself has huge impact on mental health, and disasters have even a much more impact. And this module, I think, will go a long way in helping such children as well. My last point would be, let's focus from 1000 days to the next 1000 days and 1000 weeks. The whole spectrum falls under our care. And the care, the physical well being, the mental well being, social well being, has huge impact on how they grow up as adults. And the early childhood development nurturing care framework, which focuses on health, nutrition, safety, parenting, education, values, connectedness, agency, and resilience, has to be carried on from the first 1000 days up to 1000 weeks. So, wishing all of you a wonderful, joyful family time during Diwali. Have fun, interact with parents, interact with your own young ones, and of course, with the little ones under our care. Thank you once again, and all the best.
Thank you, Preeti, for giving that great message that we have to consider next 1000 days also. Not only we are not supposed to stop. And yeah, really, it's a good motivation for all the whether it's adults and whether it's mental health. Thank you once again. Geeta, please.
Thank you very much, Dr. Preeti, that you have given us insight into this. And I'm very sure Gen Z is doing a lot, and Gen Z believe on the work-life balance. Maybe certain points are advantageous, which are not sometimes advantageous, but still mental health is essentially required, not only absence of physical health. Not only having a not having a disease, that's not a definition of a holistic health. So now I request the person, the pediatrician who has created this 9th segment of our IAP के बाद community के साथ 2.0 is Dr. Poonam Bhatia from Devas. She is known for her creative skills, her academic excellence, her interest in the mental health. So I request Dr. Poonam Bhatia to brief about how was their journey when you were creating these things, and what is your view on this. Over to Dr. Poonam.
Okay. Thank you, IIP, for giving us this opportunity. And at the outset, I would like to thank Dr. Vasant sir, Dr. Neelam Mohan, Dr. Preeti ma'am, Dr. Geeta, and Dr. Yogesh Parekh sir for giving this opportunity. And during our journey, we have a team of very intellectual people like Dr. Satish Pandya sir, Dr. Chaya Prasad, Dr. Yatish Pujar, Dr. Kiran Makhija, and Dr. Santa. So everyone gave their inputs, and we have divided the whole document into different segments. And we had almost 3 to 4 meetings regarding it. And Dr. Chaya gave a tagline like, at every stage, at every age, mental health matters. And so we started our journey in that direction only. So let us understand what everybody is talking about, what exactly the mental health is. Being emotionally stable. So a little child who enters into your clinic, and the mother says, there's nothing deviant from the normal, like he eats well, sleeps well, can separate from parents for a time being, he's not clingy. So that child is a child with good mental health. Another child who enters into your clinic, and as soon as you touch your stetho, he starts crying, he's very clingy, starts showing tantrums. So that is not a mentally healthy child. And what we as pediatrician, we can correlate, like the parents of the child who was sleeping well, eating well, they were quite responsive. While the parents of this clingy or tantrum child who is having tantrum, they themselves are having some mental health issues. So what we need to understand that these children who are clingy or who are too naughty, they are actually not naughty. They're telling us, I'm not okay. We need to take care of them. Similarly, in a school-going child, the child who has lot many friends, participate in extracurricular activities, he's confident. So that child is a child of an authoritative parent because parents have given him enough space. Parents do listen to the child. And then in adolescent, a child who can face challenges, bounce back from the adversity, and communicates their feeling, that is a mentally healthy child. So I would like to just conclude, like every pediatrician must know the red flag signs, and they should keep on communicating these red flag signs to their parents, in their routine advice, like anticipatory guidance. We all adolescent pediatricians, we give to their adolescent client. We need to give anticipatory guidance to our parents as well to identify the red flag sign, like any deviation from the normal, if it is impacting their school health, if it is impacting their health at home, that means this child is not mentally healthy. So to conclude, I would just say, like, happy minds doesn't always mean that their rooms will be always clean and tidy. But yes, they will surely make a brighter future. So we need to create a teenagers or a generation who is happy, healthy, and alive. Thank you. Thank you so much.
Thank you very much. And we know that there is such a shortage of uh, psychiatrists, and we are the first contact with the patients. We should know about the red flag signs. Over to Dr. Vasant Khalatkar, sir. Want to comment?
Yeah. So, thank you, Dr. Poonam. Really, you people had done a wonderful work for this, making all this. I know it's very difficult to make it. Thank you once again to total scientific team. Thank you. Now, Geeta Pati, next.
Thank you very much, sir. Now I request Dr. Praveen Page, sir, to introduce our guest of honor and to carry on the further proceedings. Are you there, Dr. Praveen? Unmute, Praveen. Dr. Praveen, can you unmute?
Yes, madam.
Yes.
Thank you, Geeta ma'am. And we are very fortunate to have with us today Dr. Praveen Mehta with us. He is a very senior pediatrician who has been working in IIP for so many years. Right now, as of today, he is a consulting pediatrician at the Jack and Jill Nursing Home for Children and an honorary pediatrician at H.J. Doshi Hindu Sabha Hospital in Ghatkopar, West Mumbai. He has many decades of experience in the field of pediatrics and is recognized worldwide for his work in neonatology and allergy, with special interest in vaccinology and immunology. He has been the Honorary Secretary General of IIP in 2014 and 15, President of IIP Mumbai branch in 2005, Treasurer of Central IIP in 2012 and 13. He has been a member of IIP Immunization Committee, National Coordinator of ASOV, Faculty for IIP ASOV programs, and editor of IIP Bulletin Academy Today in 2010, 11, and 14 and 15. Ladies and gentlemen, please join me in welcoming Dr. Praveen Mehta. I would like Dr. Praveen Mehta to please address us.
Thank you very much, Dr. Praveen Page, to have a very nice introduction and very kind and generous introduction. And at the outset, I also want to thank the President, Dr. Vasant Kalatkar, incoming President, Dr. Neelam Mohan, and our past President, Basavaraja, Secretary, Dr. Yogesh Parikh, the backbone of this program, that is Geeta Patil and Poonam Bhatia, and all others who have contributed, whose naming everyone may not be possible. But I thank all of them to give me this opportunity. And as Dr. Geeta Patil just now said, that the good health does not mean merely the absence of disease. It also means that what you are not treating as an organic disease, like mental and emotional health, are extremely important, because it has a effect about how we feel and how we behave in the life. And it is extremely important for children, particularly because it's a period of rapid growth for the children, and also it lays the foundation stage of mental strength and the strongness that is to be imbibed by a child. And it is particularly important because the children are challenged by so many other factors which disturbs their mental health, like peer pressure, like parental pressure, like bullying in the school. So all these the children are facing, and we really need to educate ourselves to pick up all these problems early while we are doing our regular consulting practice. And I truly thank the IAP, the president, and the entire team for organizing such a nice program and considering mental health to be an important issue that is facing us. Statistics, most of the previous speakers have already given, and not talking much, I will only say that all the best to the program, and I will once again thank the team who has prepared this module. I have gone through the PowerPoint presentation, which is extremely good. So all this scientific work requires a lot of hard work, and the team has done an excellent job. Thank you very much for this opportunity. Thanks a lot.
Thank you, Praveen sir, for joining and accepting as a guest. I know how you have handled our mental health during that last 2 years as you were as the secretary and we were on the executive board member. Thank you for those days also. Thank you.
Thank you, Mehta sir. Sir, I would request you to now release a poster related to today's activity.
So I declare this poster to be open, and since it belongs to Indian Academy of Pediatrics, every member can display this in their place of work, whether it may be government hospital or private consulting room, and it will go a long way in supporting the great efforts done by the whole team. Thank you very much.
Thank you, sir. Thank you. Now, going ahead, it is time for us to welcome our chief guest, and I would request our Honorary Secretary General Yogesh Parikh sir to please introduce our today's chief guest. Yogesh Parikh sir.
Yeah, definitely. So it is my pleasure to introduce Dr. Amit Gupta. Dr. Amit Gupta is an internationally acclaimed neonatologist in the education and the healthcare leader, currently serving as a clinical lead in the neonatal intensive care unit and the consultant with the at John Reddyfly Hospital, Oxford University Hospital, UK. He also leads International Pediatric Workforce Management at the Oxford University Hospital NHS Trust, and overseeing the global fellowship program in the neonatal and the pediatric critical care practice. So Dr. Gupta has made remarkable contribution to the neonatal care, both the UK and internationally. He was instrumental in establishing the first national newborn transport service in the South Asia, specifically in the Sri Lanka, in the collaboration with the Sri Lankan College of Pediatrician, for we has for which he has received the BMJ South Asia Award for the Innovation 2017. And in recognition of this his outstanding service, he was conferred the honorary fellowship, a highest distinguished award by the Sri Lanka College of Pediatrics in the 2016, and appointed patron of the Sri Lankan Neonatal Transport Forum. So this is a big achievement for this our Indian colleague who is serving in the UK NHS Trust, and also he has contributed a lot in the India also. For that, Dr. Amit Gupta was honored with the Lifetime Achievement Award by the our National Neonatology Forum of the India in the year 2015, to acknowledging his role in the establishing international fellowship program and organizing the national training workshop on the newborn ventilation. I think he is arranging the this newborn ventilation workshop every year in the India in the different parts of the country. And his commitment to excellence was also recognized earlier through the Bronze Award in the year 2014 by the Oxford University Hospital NHS Trust for working in the partnership, celebrating his pioneering role in the creating the International Neonatal and Pediatric Intensive Care Fellowship Program. Academically, we see that Dr. Gupta has a distinguished record, having a rank first in the MBBS, DCH, and MD Pediatrics at South Gujarat University, India. And it is my privilege to introduce him because he is my college alumni at the GMC Surat, and he has honored numerous peer-reviewed publication, contributed to very key medical textbooks, and has been invited for as a faculty at the several international and national scientific conferences, including our IAP conferences, NNF conferences, Neonatal Association at international and the Sri Lankan College of Pediatrics. So his ongoing research interests include the neonatal respiratory care and the global pediatric training. He has served as a co-investigator in the UK REACH study, almost £2.1 million national research initiative exploring ethnicity and the COVID-19 outcome among the healthcare workers in the UK. So Dr. Gupta's career is a testament to his unwavering dedication to improving neonatal outcomes worldwide, and his passion for the medical education and his commitment to building the international bridge in the pediatric healthcare. And he is instrumental to start our international this IAP UK fellowship at the Oxford Hospital NHS Trust, and we are privileged to be the part of his team during last month our visit at the UK, and he has taken very much care of all of us, Dr. Neelam Madam, Dr. Vasant Khaladkar, and myself, and he arranged a full day visit at the UK Hospital NHS Trust. So thank you to joining Dr. Amit Gupta, and we are welcoming you. And I think Dr. Vasant Khaladkar will be more enlightened on Dr. Amit Gupta's endeavor in the UK.
So I will say in a few words it's a started in India, that to be in a small village Saharanpur. That was the 30 years before he started the journey from Saharanpur, and he reached to UK. So that's a great thing. Great thing. On those days where no avenues were available, no nothing was available, no internet, nothing, and he reached to IP. But it's सबके उनके पाव जो जमीन पे है, जो बोलते कि he is taking care that his main motto is that our postgraduate students, those who are passed from India, should get something, some good learning, which is really very difficult nowadays. So he's taking that much effort that our Indian students should get the highest and highest education at UK. And not only that, everything about the, again coming to mental health. Mental health is a really issue when any student or any guy from India goes to abroad. They can suffer from various things like peer pressure and our culture and the type of working. But really, I saw that he and his team, especially Dr. Geeta was there, she was there, and they are really taking too much care of our students. Thank you once again, Dr. Dr. Amit. I think that is the best introduction of me, of you, by me. Thank you.
Thank
Uh,
you.
and Dr. Amit Gupta is very much have a fond of the cycling, and he's always going to the Oxford University Hospital to serve the children by the cycling only.
Yes, yes.
From his home to carry cycle to the Oxford Hospital.
Yes, yes.
Yeah.
Yes.
Over to you, Amit.
I would request Dr. Amit Gupta to please address today's gathering, sir. Dr. Amit?
Sir, you're muted. Dr. Amit, you're muted.
Sorry, I was going to say thank you very much for having me. And thank you, sirs, for visiting Oxford. It was a great pleasure to show you around the city. And you're absolutely right. One of the reasons I cycle to work is because there's no parking. So everything has a necessity. So parking is a very difficult thing. But I think coming back to the topic for today, in terms of mental health, I think it's a worldwide crisis, and we have to understand it. That the way we grew up in my generation, I don't think mental health was either recognized fully or the problems were as many as we see today. I certainly think post COVID, the problems have become more apparent. And I do think that awareness across the world is poor. In the UK, sir, you might think that the UK is very aware, but even in the UK, it took some time to understand how mental health was impacting a lot of teenagers. And the rise in the number of self-harm incidents is actually gone up. Now, when we were training, we used to hardly see incidents of self-harm in terms of cutting yourself. But I speak to my colleagues in Delhi, I speak to my pediatric colleagues up in Mumbai, and they report a lot of cases where young children are coming with cutting themselves or with blades and other sharp instruments. And I think awareness is really important, but very important is the tools to take the next step. And because it's not a lived experience by a generation, let me put it this way, we don't have that lived experience as much as our junior colleagues do. I think it's really important for everybody to understand that you cannot ignore it. You have to deal with it. Otherwise, we will pay the price. I mean, sir very kindly mentioned in the beginning about the fact that a lot of causes of mortality in children. I think it was it the third or fourth commonest, sir. I don't remember exactly, but suicides in teenagers and young people has risen a lot, and I think it's a crisis. We need to do something about it. I'm so glad that the IIP is taking a really proactive step in this because it is there. And let me also just mention that I come from a small town, madam. I don't come from a big city like Mumbai or Delhi from India in India. I come from a place called Saharanpur, which is a typical small town in UP. Even here, when I speak to colleagues in pediatrics, they are reporting increased incidence of mental health issues. So it's not limited to people in bigger cities. It's not linked to, it is a global thing. So I'm very pleased, sir, that you had come to Oxford. We do try and take care of a lot of the issues that are raised by our visiting doctors, our junior doctors who come. To give you an example, the Oxford neonatal unit, madam, has got nearly 39 doctors working at the junior level as a resident level. Out of the 39, 20 are from overseas. So we are 50% of the workforce from India and from Sri Lanka. And I think we just have to be very careful and look after them. So we run a very strong mentorship program. We have an open door policy for problems that trainees have. And so I'm really pleased that that the IIP has taken this strong stance, and hopefully the message through your good channels will spread around the country. Thank you.
Thank you, Dr. Gupta.
Really,
And
yes. You,
Vasant sir.
yeah, thank you, Amit. You told the facts and how is it going. This experience counts, really, and whatever happened with you. Really, thank you once again. Thank you for joining. Praveen.
Thank you, Dr. Amit Gupta. I'd just like to share with you that IIP has guidelines on suicide prevention and management of suicidal behavior in children and adolescents. So we would be happy to share those guidelines with you as well. Thank you.
I'm so pleased, madam, that it's dealing with in a much more proactive way. And I would like to say that even sitting in the UK, the rise to recognition came late. I must admit that it wasn't as quick because people were still quite bewildered with the rise. For the first couple of years, people were just amazed at why the crisis had increased. And before long, it became a bigger crisis. In fact, the largest number of waiting lists for pediatric mental health services has grown in the last 3-4 years because it is a real issue. Thank you.
Thank you.
Thank you, Gupta sir. I would now request you to release a video which highlights the crisis of mental health in children and declare it open once it plays out.
Thank you.
Rajiv?
Every child deserves to laugh, to play, to dream. But sometimes their smiles hide silent struggles. Stress, anxiety, sadness. Children feel them too. When we listen, when we support, we give them the strength to heal. Mental health matters. As much as physical health together, let's nurture minds, not just bodies. Physical health is visible, but mental health? It's often silent. And for children and adolescents, it matters more than ever. Children may struggle with fears they can't explain. Adolescents may battle stress, pressure, identity, or loneliness, yet hide it behind a smile. Depression, anxiety is increasing in teenagers. 50% of mental health disorders manifest by the age of 14 years. Prevalence of suicide is increasing. Reasons are increasing: academic, peer, social stress. Response to stress is exaggerated due to the neurodevelopment. Many of them lack life skills to face challenges in life. Academic expectations, peer pressure, bullying, social media, all can weigh heavily on young minds. But mental health support changes everything. When we talk openly, when schools, families, and communities listen with compassion, when we normalize seeking help, young people feel safe to heal. Because when children and adolescents are mentally healthy, they grow into adults who are strong, kind, and resilient. Mental health matters, especially for children and adolescents. Let's care for their minds, not just their marks.
Thank you very much. I would like to declare this open and for use. I really loved the last line, which was, let's care about the health, not the marks. I think it hits the nail, really. And thank you for producing such a lovely video.
Thank you, sir.
Thank you very much, sir.
Thank
you. As we come to the end of this program, we have with us our senior colleague, Dr. Kishore Bendu, sir. He is online directly from Australia. I would request him to now propose a vote of thanks. Kishore, sir.
Thank you, Dr. Praveen. Good afternoon. I'm not yet there. I'm on the way somewhere. So, yeah, you would see me very much in India now. So, here we go for a very, very pleasant duty of every IAP Ki Baat community ke SATH program, and that is thanking all the gentlemen and ladies who made this program a grand success. We are in the 9th edition of this program. In this year, including the 12 that we had last year. So it is growing in strength day by day, and wonderful topics, innovative topics are being taken up. And what better than when a topic like mental health matters to all, especially for children in this particular version. At the outset, let me start to say that in the context of Indian philosophy, life is compared to a chariot, the body being the chariot, the senses being the horses, the mind, the reins of this horses. It is controlled by the intellect, which is the charioteer, and the soul or the self being the passenger. The goal of life, as per this analogy, is for the intellect to effectively control the senses through the mind or the reins. So the soul can reach its ultimate destination, which is spiritual liberation. So ultimately, it is the mind which controls most of the disease patterns that the body sees, so beautifully described and elucidated in this particular program. I should say thanks to our chief guest, Dr. Amit Gupta, for joining us from UK. And thank you, sir, for collaborating with IAP in the fellowship program. You have definitely brought out and highlighted the worldwide crisis and the increase in mental health problems all over the world, especially in the UK and other places. And we do not lag behind. We too have a score of mental health problems which are increasing day to day. To Dr. Praveen Mehta, our ex-Secretary General of 2015, for his very apt description of mental health and its importance. Thank you very much, sir, for your presence here, your very gracious presence, and being the guest of honor. To our very, very own people, our dear President, Dr. Vasant Kalatkar, Dr. Neelam Mohan, our President-elect, Dr. G.V. Baswaraja, in absentia, our extremely popular Honorary Secretary, Dr. Yogesh Parikh, who welcomed all the guests, introduced our chief guest today, Dr. Athanu in his absence, Dr. Preeti Galgali, our very own Vice President from the South Zone, who gave us an insight into the mental health problems. She also spoke about the IAP program on suicide prevention, etc. Thank you, madam, for that chipping in of the thing in your speech also. To our national coordinators, led by Dr. Geeta Patil from the Scientific Committee, Dr. Praveen Page from the Monitoring Committee, a big thank you to all of you. To the experts who have brought out such a wonderful presentation, a press note, and all the scientific material, led by the convener, Dr. Poonam Bhatia, Dr. Satish Pandya, Dr. Chaya Prasad, Dr. Yashish Pujar, Dr. Kiran Makhija, Dr. Santa Chattopadhyay. So thanks to this expert committee who's brought out this program. To all the OBs, the EBs of 2025 who are present here, to all the senior members, colleagues of IAP, not to forget the backroom staff, which always does such a wonderful job in flawlessly arranging for this program. Thank you very much. And if I have left out any particular names, I would beg your forgiveness for that. Thank you all for this wonderful program. We wish you all best and have a happy, safe, and Diwali and a prosperous New Year. Thank you very much, sir, for the opportunity given. Thank you, Dr. Geeta, for calling me to give this prestigious vote of thanks. Thank you very much and namaskars.
Thank you, Vaidan sir, for giving us energy actually. Though you are in Australia, still you are there. Thank you.
Thank you. Thank you very much, sir. 16th segment we did last year. This is a 9th segment.
Oh,
as Kalatkar sir always tells me, tell about the next topic. So November is child rights, sir. And this is that is a child right week will be there that time. So rightly taken topic is a child right for the next month. And that is also been going to be created by very enthusiastic and learned experts. Thank you very much, sir, for giving us opportunity.
Thank you, sir.
Our Dr. P.
Vasant.
Ashok Kumar sir here for this wonderful creation for the child rights week. Last year he proposed that and we accepted that proposal. Ashok Kumar sir, it is.
I think he left, I think so.
No, he is here.
No. I'm here. Thank you.
He's here.
Thank you, Gila madam. Thank you, Yogesh sir, and thank you, Dr. Kalatkar sir and other team. And it is, I thank you all for giving me the opportunity to work on the child rights program on IAP Ki Baat. Hopefully, we will come out with a wonderful program next month. Thank you. Thank you very much, sir.
Best wishes, sir. Best wishes.
Thank you. So let's join next month.
Thank you, sir. Thank you.
Thank you very much, sir.
Very, very happy
Thank you,
Deepavali to
Pran Mehta
all of
sir.
you.
Thank you, Amit.
Thank you.
Thank you.
Thank you,
Bye-bye.
everyone.
Sir, Amit
Bye.
Gupta.
Good night.
Thank you, Poonam.
R.K. Agarwal sir.
Thank you,
Namaste.
everyone.